Welcome, everyone. I'm Dr. Liana Lianov. I'm the president and founder of the Global Positive Health Institute, and this is our GPHI podcast where we talk about all kinds of things related to lifestyle medicine, positive psychology, health and well-being, and healthcare. And today, I'm delighted to have Dr. Michelle Tollefson with us. She's a women's health and lifestyle medicine expert. She's a professor at Metropolitan State University of Denver. Welcome, Michelle.
Thank you, Liana, for the invitation. I'm excited to be here with you today.
Yeah. And you've been part of the lifestyle medicine community. You've also served on the board of the American College of Lifestyle Medicine. And we were just chatting that you were also way back a wellness coach. So this wellness area has been a passion of yours. What first grabbed your attention to healthy lifestyles and positive approaches?
Sure. So I grew up in a really healthy environment, eating foods that were from my dad's garden that my mom cooked, and getting a lot of physical activity, enough sleep, and not really stressed. And then I went to medical school and did my OB-GYN residency and was under tremendous stress, sleep deprivation, because I was in training before the 80-hour work week law went into effect. I ate a lot of processed foods from our cafeteria, and at night, our cafeteria was closed. And so McDonald's was in our hospital basement and was all that was available. So I would try to make the healthier choices, but still not eating the healthiest, not getting very much exercise. And so I was just surviving. When I got out of training, I was like, I want to thrive again. I want to feel good. And so that's when I really started going back. I moved back to Colorado, where I am now and where I grew up, and tried to start getting back into eating more of a whole food, plant-based way of eating and more physical activity, stress reduction or resilience activities, prioritizing sleep and social connections. And I started to feel like I was thriving again. And then 3.5 years ago, I was diagnosed with an aggressive breast cancer on a routine screening mammogram. There was a 2-centimeter mass that was found invading my chest wall, which I couldn't feel. And I was treated with bilateral mastectomy, 16 rounds of chemotherapy, and 7 surgeries in total over the past few years. So I'm fortunate that I came out on the other side, but that really took me back to feeling like I was just surviving. And when I finished treatment about 3 years ago now, I finished the chemotherapy, I thought, I have not fought this hard to just merely survive. And that's when I really tried to embrace lifestyle medicine even more. Like during chemotherapy, I did some physical activity every day and worked with a physical therapist. So I was very lifestyle medicine focused even during my active treatment. But then as a survivor, I realized that in order to thrive again, I was really going to need to be ultra focused on embracing healthy lifestyle behaviors, and then also embracing activities that brought joy, and to look at my attitude and my way of thinking. I didn't want to be just a survivor. I didn't resonate with that word. I appreciate that I was able to survive, but I wanted to thrive. And so I really did some deep kind of personal work around that and tried to move forward in the area of thriving after chemo.
Wow. Well, thank you for sharing that story. I have to say that you are an amazing role model for resiliency and the positive desire for growth in the face of difficult times and trauma. And that's a lot of what we talk about in the positive psychology community, that actually using these kinds of approaches can help us grow, almost even not in spite of, but because of some of the difficulties that we face. And you're a wonderful example of that. So thank you so much. And what are some of your favorites that have really rung true for you in terms of helping you become resilient?
Sure. So focusing on gratitude, that's something that I do every day. In fact, my boys, I have a 10-year-old and 7-year-old boys, and when my husband drove them to school the other day, he said they commented on that they liked when I drove them to school better. And my husband asked them why, and they said, because mom always asks me what we're grateful for. They have to say 3 things they're grateful for before they're able to get out of the car. So really trying to focus on gratitude. That's something that I tried to do before, but I think going through a trauma where things are, you kind of look at your own mortality in a different way really helped me to truly appreciate or to be grateful in a different way, though I still forget. Also to focus on what's going right with, once again, with all of these things, I wish that I could say that I do a wonderful job, but it is still always a journey. But I try to focus on what's going right, or especially when I'm struggling with something, to be able to go back to, okay, life isn't all bad. What is going right in this situation? Working on my strengths. My kids struggle with some different issues, and so we're always looking at our strengths, both my strengths and their strengths, and how can we work on enhancing those rather than just focusing on what we can't do well or what doesn't come easily. Let's see, I think so. Yeah, so I've also really enjoyed looking at the science around post-traumatic growth after a cancer diagnosis. So I know it can occur after any trauma. And at first, after I went through treatment, I didn't like that word, because I thought, I can't say that I've been through a trauma when I know that there are other people who've been through sexual abuse or through like active combat zones. And I thought, like, how could I even think of using that word when I don't believe that my trauma that I went through is significant enough to even compare to what some other people have been through. And then I realized that we all have different struggles and different, maybe some are smaller traumas than, of course, others.
Yes.
But to be able to think of, like, what is it that we've gone through, and then what can we take from that? It almost made me like greedy. Like, I don't want cancer to have taken so much from me. I want to be able to get back some of that control. So even right after my diagnosis, I was I shared my mammograms on our local news, and told people, like, go get your screenings. I wouldn't have known about this. I had no symptoms, because I'd seen so many patients as being an OB-GYN. I had done breast exams, and there's so many women who say, like, oh, well, if I would feel something, I would know something. And I was like, I had no idea. So I tried to use it for positive, and then also really trying to teach other breast cancer survivors or cancer survivors about the literature around post-traumatic growth. Not that I want them to see their cancer as, like, glad this happened, but helping them to realize that even though it was most likely traumatic, that there still is that potential for growth, because I think that's something that we don't talk about enough. And I think that gets many cancer survivors very excited, because it's not just focused on disability and to decrease that disease or that struggle, but that it's really to move beyond that. And then even if you still have struggles, like I still have neuropathy, and that will probably never go away, and I still am more fatigued than I was before chemotherapy, and I don't know if that will ever go away, but focusing on, even though I have those struggles and limitations, and I probably will never have full feeling of my fingers back, that I can still flourish and I can still thrive in many different areas. You don't have to have complete 100% health back or physical, function back in order to thrive in so many different areas. And that was when I had first come out of treatment. I really focused on what I couldn't do. And I still want to optimize and do everything I can, but still trying to focus more on how can I thrive, even if there are still some limitations.
That's so well said. The two big points there that you made. One is that we all struggle with small or large traumas, the bumps in the road of life. That's for all of us. It's a part of being human. And some of us may actually even have backgrounds that it may affect a seemingly small trauma. It may affect us emotionally more than other people. So we really have to stand back and have that expression of our individuality and compassion and self-compassion for that. And then the other point you made is that a lot of this really, the way we can grow through these difficulties is a reframing or a refocusing. It's not that we can be happy or have these positive emotions when all is well, or we have all our functionality back, or everything's great in our lives. It's about, okay, we're all going to always have some difficulties, challenges, ongoing. They probably won't ever go away. And so what are some pieces in our lives that we can use to elevate some joy, some positive emotions, even just micro moments of positivity can add up through the day, through the week, through the month, and that can be very powerful. So, yeah.
Thank you.
And you're a colleague in the lifestyle medicine community and women's health. Share with us a little bit more about what we've been talking about, how you use that professionally.
Sure. So I went through menopause about a decade earlier than I was planning on going through it with chemotherapy. And then I had my ovaries removed because of the type of breast cancer I had. And so I had menopausal symptoms, and it was hard to tease apart at first what were the after effects of chemotherapy versus what were menopausal symptoms. And so I started looking into the literature around menopause and lifestyle medicine and found that it was often very, once again, disease focused. And even though we know that menopause is not a disorder, like it's part of the natural lifespan and what a woman goes through if she's fortunate enough to live long enough, it still seemed like so much of the information about it was very negative, or came from a place almost of like disease. And so I really tried to look at the literature and around what healthy lifestyle behaviors there were and how we could look at it from a place of flourishing and thriving. And so one of the biggest changes I think that I made after coming out of my treatment, and that I've tried to convey to others that I think has been powerful for many women, especially in the menopausal transition and beyond, is setting goals that help us to setting magnetic goals, or setting goals that we feel pulled to or drawn to rather than pushed towards. And that's what I said before my cancer diagnosis. I think that I did lifestyle medicine from a place of lots of shoulds, like I should exercise 30 minutes. I should eat this, should. And I realized, though, I was getting to possibly the same place, that after cancer, I wanted to make sure that the route I was taking was as joy-filled as possible. And once again, always bumps in the road. What could I do to make that a more joyful experience and really appreciating every day? And that's where have tried to think about goals in a more positive way. What's pulling me towards it? So looking at purpose, or how can I incorporate joy and fun? And, sometimes it's like I might arrive at the exact same place, like increasing fiber intake or exercising 150 minutes a week doing resistance training, but is there any way that I could get there in a way that makes it as joyful of a journey as possible, incorporating a little fun, a little variety, bringing in some friends. I've been doing exercise snacks, and I used to like run up and down the stairs, and I was like, I'm going to turn on music for my like 1 or 2 minutes and do some jumping jacks and kind of run and dance. And I don't know if the neighbors are watching in, but anyway, it's my way of getting in a little physical activity, but it's a way of doing it that is more fun for me. So I think those are some of the ways I use it professionally and with women, especially in the perimenopausal transition and beyond, is looking at how can we do lifestyle medicine, but how can we do lifestyle medicine in a way that's joyful, that's fun. Like in nutrition, we can say, oh, I'm going to make sure I eat X, Y, and Z, or we can say, how can we have fun exploring new tastes? And, could you investigate new types of ethnic cuisines? And so trying, not doing something totally different, but just trying to help people frame the joy of movement rather than exercise. I tell people, to me, exercise is a 4-letter word. I'm not somebody who just naturally loves running marathons. No, that's just not me. But how can I do some joyful movement? So I do some Zumba every day to somebody who broadcasts from Belgium, and I have a lot of fun. They dress up in different costumes sometimes for holidays, and I'm able to join in. And for me, that's fun. So I think trying to help women really look at their lifestyles, look at how they can move from surviving to hopefully thriving, whether they're a breast cancer survivor or any woman along that spectrum, and then trying to look at the lifestyle medicine pillars through more of a positive health, positive well-being, flourishing, thriving type of lens.
Yeah, absolutely. You've described that upward spiral theory of lifestyle change, that if we can embed some positive emotions in those healthy activities, we're more likely to do them. The more we do them, they directly boost our positive emotions, and around we go, and it's quite powerful. So yeah, the very, very basic part of what we need to do if we're looking to promote healthy lifestyles, positive activities for our well-being. What are some of your favorite resources where you turn to for how to do more of this, and examples, books, etc.?
Yeah. So I love the Greater Good Science Center. I love the resources that come out of there. Some of the different apps like Calm. I would say, just listening to a lot of the American College of Lifestyle Medicine resources. I've been on and serving my second term on there because of course is the secretary, and I love the resources that come out from ACLM and past recordings. I love books, so I always have a variety of books on my playlist. I love Fiber Fuel. That I forget his name. He spoke at the recent ACLM conference. He was fantastic, Dr. B, I believe. And then I'm listening to The Good Life right now. And I just finished Happier Hour by Cassie Holmes and Together by Vivek Murthy, Surgeon General. So I would say some of those are some of my favorite books, as well as our resources. As far as Brene Brown's Atlas of the Heart, I love that. I love that book.
Yeah.
Oh, The Happiness Trap. The Happiness Trap is a great one. Practice of Groundedness. Anyway, I love From Strength to Strength, Start with Why. I have a lot of different books. So I would say books are kind of my go-to to try to learn new things. I do a lot of driving with having two younger kids and then one older daughter, and I'm able to listen to the books, and that helps me.
You mentioned a wonderful list of books there, so thank you. I'm familiar with most, but not all, so I'm going to pursue some of the others that you mentioned as well. Well, as we wrap up, is there one key idea that you would love to impart on our listening audience? What should they walk away with, remembering our discussion here?
Oh, I think my main message has just been to try to get people to understand their potential for thriving, that wherever they are at, regardless of limitations, regardless of coming cancer screening tests or upcoming procedures or limitations, that they can thrive, that there are so many dimensions that they can thrive, and that it's that they don't have to go to a state of absolutely no disease in order to thrive, that they can still have great happiness and joy and a very, very fulfilling life if they align with their purpose and practice some of these positive health practices. That still is very possible, because I don't think that that's a message that we get out enough.
Very hopeful, and we all need hope, and that's a great platform upon which to and a springboard for so much in our lives for health and well-being. Well, thank you, Dr. Michelle Tollefson, for joining us on this brief GPHI podcast, and thank you to our listeners. I hope you'll join us on another one of these podcasts, and until next time, be happy, healthy, and safe. Take care, everybody.